If your shoulder hurts and you just can't lift your arm under your own power, but it goes up when someone lifts it for you, and it aches most at night, that pattern points toward a rotator cuff tear. If your arm won't go up even when someone lifts it for you, that leans more toward a frozen shoulder. These two are genuinely easy to confuse, because both are common between your 40s and 60s and both can ache badly at night. In the next few minutes I'll walk you through the typical symptoms of a rotator cuff tear, the one simple difference that separates it from a frozen shoulder, a self-check you can do at home, when surgery actually gets considered, and the warning signs that mean you should be seen quickly. So what is the rotator cuff, and why does it tear? It's a group of 4 muscles and their tendons that wrap around the top of your upper arm bone. Together they lift and rotate your arm and keep the ball of the shoulder centered in its socket. A tear happens when one of those tendons frays or tears, partly or all the way through. There are 2 main ways this happens. The first is degenerative. With age, the tendons gradually weaken, blood flow to them drops, and years of overhead use slowly wear them down, with the risk climbing after age 40. The second is a single traumatic event, like falling onto an outstretched arm or lifting something heavy, the supraspinatus. Let's talk about what a rotator cuff tear actually feels like, because the pattern is fairly consistent. You get pain when you lift, lower, or rotate the arm. You feel weakness, like the arm gives out when you try to raise it or carry something. Reaching overhead to a high shelf, or behind your back, becomes a struggle. And there's that night pain that wakes you. Worse when you lie on the sore shoulder. Some people also notice clicking, popping, or a grinding sensation. Here's a quick self-check. Do you get sharp pain at a specific angle when you raise your arm? Trouble reaching overhead or behind your back? Night pain, weakness, or a giving way feeling? And the Now here's the difference that really matters, because the condition most often mistaken for a rotator cuff tear is a frozen shoulder. Both show up at similar ages and both ache at night, so they're honestly hard to tell apart. The single most useful clue is what happens when someone else lifts your arm for you. A rotator cuff tear is a tendon problem. Lifting under your own power is painful or weak, but when someone lifts your arm for you, it often goes most of the way up. The main story is weakness and pain. A frozen shoulder is a problem of the joint capsule itself. The lining tightens and sticks, so both your own movement and assisted movement are limited, and turning the arm outward is especially blocked. So the one-line question is, when someone lifts your arm, does it go all the way up? Yes. So what actually helps? For most rotator cuff tears, the first line approach is non-surgical. A torn tendon won't reattach to bone on its own, but many people still regain good, comfortable function without surgery. That usually means cutting back on overhead work and the positions that flare your pain, anti-inflammatory pain relievers used under a clinician's guidance, and physical therapy. Rehab is staged. Once the sharp pain settles, you work first on restoring range of motion, with gentle moves like pendulum swings, then gradually build strength. Sometimes a steroid injection is considered to calm things down. About 8 out of 10 people with partial tears improve with non-surgical treatment, but it can take up to a year, so consistency really matters. Surgery gets considered when pain or function isn't improving after months. Before we wrap up, let's cover the red flags, because some signs mean you shouldn't wait it out. Get medical care without delay if, after a fall or accident, you can't lift the arm at all or it goes suddenly weak. Also if weakness keeps getting worse, if there's shoulder deformity, severe bruising or swelling, or numbness and tingling, or if you have a fever and feel generally unwell along with the shoulder pain. Those can point to a serious tear, a fracture, a nerve injury, or a joint infection. So here's the quick summary. If your arm goes up when someone lifts it but is weak and painful on your own, think rotator cuff tear. If it won't go up even with help, think frozen shoulder. Most